Guys, in this video, let us look at this topic nasal furuncle. Basically, furuncle, if they ask you, you will have to write furuncle in different parts of the body, like ear, it can be their nose. Basically, it is the problem with the hair follicle. Hair follicle will be infected, right, with Staphylococcus aureus. So, hair will be there where here in the vestibule, right. So, basically, here we are more focused on the furuncle in the nose, nasal furuncle only we are concerned about here. Why? Because you know the dangerous area of the face, right? You remember this diagram, right? Face, dangerous area of face. So basically from the facial vein into the deep facial vein, into the pterygoid venous plexus, emissary veins, cavernous sinus. So from here the infection can spread to the cavernous sinus in the brain, right? In the cranial cavity. So basically what you have to understand here is it is very easy for infection to spread from here to there. That is why nasal furuncle is an important topic. Okay. So even wherein all furuncle can be there? Even in ear. So basically facial vein rests directly on muscles. These veins, they don't have valves. So as they don't have valves, they can allow the blood to flow directly to the cavernous sinus. Okay. So what is this nasal furuncle? It is also, they are calling it as furuncle or boil. Furuncle or boil. So basically you should understand that here, if they are asking nasal furuncle only, you will explain nasal. Otherwise you have to explain ear also if they say only furuncle. So this is acute infection of the hair follicle. Acute infection of hair follicle. Okay. Follicle, spelling follicle, by what? By Staph aureus, that is a bacteria, right? Staph aureus, that is a gram-positive bacteria. Staphylococcus aureus, you can write full name, Staphylococcus aureus bacteria, okay. So basically people who pick their nose, right? So picking the nose, etc., whoever does this, trauma, they will cause trauma. And also whoever are trying to pluck these vibrissae, that is stiff hairs, right? So that is also a predisposing factor for this nasal furuncle or boil. This lesion is small, okay, but it will be painful. Okay, this lesion will be small, as you can see here, it's very small, but it will be painful and it will be tender, okay. And inflammation may spread to the skin of nasal tip. So this inflammation can spread to the skin of nasal tip. So where is this skin of nasal tip? And it can also spread to the dorsum. So where is this? So this is the ala, guys. If you don't know the parts, this is the ala. This is the dorsum of the nose, right? This is the ala. This is the dorsum. This is the apex. So let us say this is what they are referring to as tip. So what they are saying is the infection can spread to the tip and dorsum, and the dorsum can become red and swollen. Okay, the furuncle may rupture spontaneously. So as a what will happen? It may rupture by itself. Otherwise, then what to do if it doesn't resolve? So what you have to do is basically, as a treatment, so you should make sure that you will give warm compress analgesics to relieve pain. Warm compress analgesics to relieve pain, right? Topical and systemic antibiotics, because it is a bacterial infection, right? Staphylococcus. So you will give topical and systemic antibiotics, okay. If a fluctuant area appears, incision and drainage can be done. That means if there is a weak spot, then you can incise that weak spot, right? And you can drain it. So they are saying incision and drainage. Okay. What they are telling here is caution. What they are telling is don't squeeze it. Okay. Or don't prematurely incise it. Only if, when will you incise it? They are saying if fluctuant area appears, then you will incise and drain it. Okay. If fluctuant area appears, then you incise and drain it. But the main thing here is don't squeeze it, okay, and don't prematurely incise. Don't prematurely incise, okay. Why? Because you can spread the infection from this to the facial vein to the, we saw that pathway, right? Where is that pathway? We saw from facial vein to deep facial vein to pterygoid venous plexus, emissary veins, cavernous sinus. Let us see that a little more in detail. Wait. So they are saying facial vein, from facial vein to deep facial vein to pterygoid venous plexus to emissary vein to cavernous sinus. Okay, so that is where the whole problem will be there. You will be directly taking the bacteria into your brain. So what else is there? It can, so basically danger of spread of infection to cavernous sinus through venous thrombophlebitis. So this is what they are saying. Let's take this sentence here. Look at this. Danger of spread of infection to cavernous sinus through venous thrombophlebitis. Okay. A furuncle of nose may complicate into cellulitis of upper lip and septal abscess. So it can cause what? Cellulitis of upper lip, or it can cause septal abscess. Now what does that mean? So basically, where is upper lip? So it can cause cellulitis of upper lip and it can cause septal abscess. This is the nasal septum, right? So middle. So septal abscess also it can cause. Okay. So that's all about nasal furuncle, guys. So let us just review this. So we are only speaking about nasal furuncle here. Furuncle as such can refer to any place, even the ear. So if they ask furuncle in exam, you'll have to explain all the other things. But here we are talking about nasal furuncle. So basically what did we see here? It's acute infection of hair follicle by what bacteria? Staphylococcus aureus. They're calling it as an acute infection. So why is this caused? By picking of nose or plucking these vibrissae, that is stiff hairs, okay, in the vestibule of the nose. So you know where the vestibule of the nose is, right? Here you have the vestibule of the nose. You can see here. This is the nasal vestibule. Basically here it is covered by skin, right? So there will be hair. So whenever they speak about septum, they say septum proper, right? That will not be covered by skin. That will be covered by mucous membrane. Okay, that's why it's called as septum proper. Now, what and all are the causes of nasal furuncle? Picking of nose, causing trauma, right? Because of this, there can be trauma. Vibrissae, stiff hairs, plucking, okay? Then, what will happen to these? They can spontaneously rupture, right? And they can resolve, else. How will you treat? Warm compress, analgesics to relieve the pain. Then you can give topical and systemic antibiotics, right? Because it's bacterial. Incision and drainage only if the fluctuant area appears. Don't squeeze, don't prematurely incise because you will be, there are dangers of spreading the infection to cavernous sinus through venous thrombophlebitis. Further, how can it complicate into cellulitis of upper lip and septal abscess, guys? Just one more point here that we didn't write from the textbook, that is it will be small but painful, okay? It will be small but painful, okay? And it can spread to tip of nose and dorsum etc. of the nose can appear red, okay? So that's all about nasal furuncle or boil also, they have called it here as boil, okay? So if they ask nasal furuncle, you will write this much in the exam, okay? Bye bye.